So, what are we looking at?
Apurv, you've been doing CT biopsies for a very long time. What were some of the challenges in the past?
So doing CT biopsies, the most important challenge we face is needle guidance. Needle guidance and shortage of time. You have to do biopsy in between your routine procedures.
So you want something faster?
Yeah, fast.
And more precise. So how are you using precise intervention to solve these challenges?
So we were in search of something which will help us in guiding our needle. Suppose I'm not doing intervention, some newcomer is going to do the intervention. It's always dependent on the experience level of a interventionist to guide the needle, because it's a subjective job. But if you have something which will help you to see what is the deviation of your needle, what is the angulation of needle, what is the tip to target distance which is required, so it is quite helpful.
And you're showing a case of a right lung mass.
Yeah.
And maybe you can walk us through the process of what we're seeing.
Yeah. So here we can see there is a lung nodule. So plan was to do the biopsy of this lesion and know what is the nature of the lesion. So is it malignant or a benign lesion? So biopsy is the gold standard thing, whether you do any imaging, but biopsy is the answer to the lesion. So we did plan this patient for the biopsy, and here we can see the precise intervention part, which is an AI driven tool. Here we can see three images. One is your true axial images. This was the previous era which we used to have like axial images, but in addition to this you can also see there is a sagittal multiplanar formatted images. So you have idea of the lesion in both the planes, in axial also, in sagittal also.
Okay.
And with that you have two things more. One is the green part and another is the blue part. In green part, what we are seeing, green part is the needle tracking view, in which the machine automatically tracks the trajectory of the needle.
Basically stay on to the plan as much as you can, and the AI is helping you during the intervention.
So by using AI, right now we are doing even small nodules biopsy, which are around 4 mm or 5 mm without multiple passes, because if you are doing multiple passes through the lung, it is going to cause problem to the patient.
More pneumothorax, more pneumothorax. So you're doing 4 millimeter nodules, 5 millimeter nodules?
Yeah, we are.
Are you also doing it faster?
Yeah, we are doing faster also. We can be at the side of the patient so as the patient is more confident on the biopsy procedures, because most of the biopsy procedures which we are doing are in local anesthesia.
So you stay in the room for the entire case?
Yeah, I remain beside the patient with my all controls in my hand. We have gantry side monitor also, we have floating ceiling mounted monitor also, we have foot pedals also, so we can do everything which a tech can do from his room, console room. We can do all these things from the table side of the patient. And there's one more good thing, that the radiation dose is low because of the precise images.
Sounds like AI is giving you better image quality, more precision.
Yes.
But it's also making these procedures faster. How fast can you do a lung biopsy now?
So we are doing lung biopsy in 15 minutes around. This is the usual time we are taking.
So it sounds like AI and precise intervention is giving you better image quality. It's making the procedure more accurate. It's allowing you to stay in the room, which allows you to do these with local anesthesia. What do you think the biggest benefit is?
One, the most important thing is having a patient connection. If you are at the side of the patient, then you can take care of the patient. Patient is also more confident on the procedure because he is getting the procedure in local anesthesia. So patients are happy with the procedure.
You're more confident, patient is more confident. That's a win-win.
Yeah.